We'll see how to systematically approach towards complete blood count. So, complete blood count, as you all know, it is an important diagnostic test to know about the patient's condition or assessment of his or her health. So, approaching to a complete blood count report involves analyzing the different components of the test and understanding their normal ranges and interpreting deviation based on clinical context. So, here is a step by step guide on how to approach to a CBC report. So, first of all, you have to check the main components of the CBC. The first one is hemoglobin. The normal range is from 13.8 to 17.2 gram per liter in male, and in female it is from 12.1 to 15.1 gram per liter. So it is different in different books, but normally you can say it is from 12 to 16 gram per liter and it will be considered as normal. So if the hemoglobin level is low, so it is known as anemia. Anemia can indicate blood loss, because if blood loss is there, RBC loss will be there, and thus hemoglobin loss will be there. Nutritional deficiencies such as iron deficiency, vitamin B12 deficiency, and folate deficiency. So if there is deficiency of iron, so there will be deficiency of heme content, so hemoglobin will be deficient. In case of B12 deficiency and folate deficiency, it is known as megaloblastic anemia. In case of chronic diseases or nutritional deficiencies also, the hemoglobin concentration can be low, because in chronic diseases the amount of calorie intake or fat intake or protein intake can be low. In chronic diseases like in liver diseases, as liver produces globulin, which is important component of hemoglobin. So if the globin is less, then the hemoglobin will also be less. In case of bone marrow problems, in the bone marrow all the blood cells are formed inside the bone marrow or pluripotent stem cells. So if bone marrow problem is there, there will be decreased formation of blood cells, and thus there will be decreased hemoglobin. High hemoglobin, which is also known as polycythemia, could indicate dehydration. As in case of dehydration or salt and water or electrolyte loss, the blood will get thick, so it will falsely represent high hemoglobin levels. In case of smoking and lung diseases or high altitude adaptation, as you know, in case of high altitude, the partial pressure of oxygen is less, so our body adapts according to that and it produces more number of red blood cells so as to cope up with the low oxygen partial pressure. In case of lung diseases, lung if the lung tissues are destroyed, so transfer of oxygen from the environmental air or the alveolar air will be less towards the blood vessels, so our body increases the number of red blood cells so as to cope up the lung diseases. The next one is hematocrit. The normal range is from 40.7 to 15.3, and in females it is 36 to 44.3 percentage. It reflects the percentage of red blood cells in the blood. Like if we take blood from any patient and if we centrifuge it, then around 45% of the content, the sedimented content, will be of blood cells and mainly of red blood cells, because it is highest in the number. It is also known as PEG cell volume. So if the PCV is high or hematocrit is high, then the hemoglobin will also be high. If hematocrit is low, then hemoglobin will be also less. So here we come towards the red blood cell count. The normal range is 4.7 to 6.1 million cells per microliter, and in case of females it is 4.2 to 5.4 million cells per microliter. So it helps to evaluate the body's capacity to carry the oxygen. Like if the body is not able to carry much oxygen, then the body has to increase the number of red blood cells. If the number of RBC is less, it is known as anemia, In case of anemia, the number is less. In case of bone marrow suppression, the RBC number is less, and hence the patient will feel fatigue. High RBC, if the number is high, then the condition is known as polycythemia. It can be falsely present high in case of dehydration. In case of chronic hypoxia, the number is increased to cope up with the hypoxic conditions. White blood cell count, WBC. The normal range is 4,000 to 11,000 cells per microliter. So high WBC count often indicates infection, inflammation, stress, and in some cases leukemia, which is blood cancer. Low WBC count, also known as leukopenia, may suggest viral infections, bone marrow suppression, and certain medications like chemotherapy, which decreases the number of white blood cells. Now, the white blood cells, as you know, it is of different types like neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So the total number of ranges from 4,000 to 11,000 cells, out of which the neutrophils are the highest, 50 to 70%. Neutrophils are generally increased in case of bacterial infections and acute inflammations. Low levels could indicate bone marrow suppression or severe infection. The lymphocytes, it is 20 to 40% of the total WBC in normal conditions. The lymphocytes are elevated in viral infections and certain chronic bacterial infections. The number of lymphocytes are less in case of immune suppression as seen in HIV. Monocytes, the normal concentration is 2 to 8%. It is increased in case of chronic infections like tuberculosis or inflammation. Eosinophil, the normal concentration is 1 to 4%. Eosinophils are raised in allergic conditions and parasitic infections. Basophils, it is 0.5 to 1%. Basophils are increased in allergic conditions and certain chronic inflammatory conditions. The platelet count, the normal count ranges from 1.5 lakh to 4.5 lakh per microliter. High platelet count, also known as thrombocytosis, can be due to inflammation, bone marrow disorders or cancers, or infection. Low platelet count, also known as thrombocytopenia, may suggest immune disorders, bone marrow suppression, that means bone is not producing enough platelets, and increased destruction of platelets. It is also low platelet found in dengue infection. Now MCV. The normal range is 80 to 100 femtoliter. It is the mean corpuscular volume of red blood cells. So in case of microcytic anemia, the size is less. So the MCV will be less. It is seen in iron deficiency anemia and thalassemia. Because of iron deficiency, hemoglobin is less. So the RBC, the color will also be pale. High MCV, known as macrocytic anemia, means the size of RBC is big. It is seen in case of vitamin B12 or folic acid deficiency or in case of liver diseases. Mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration, the normal range is 27 to 32 picogram and the normal MCHC range varies from 32 to 36 gram per deciliter. This gives insight into the hemoglobin content per red blood cells. Lower value of MCH and MCHC suggests iron deficiency anemia. Higher values of MCH and FCHC are seen in case of spherocytosis or other conditions affecting red blood cell structure. Then the red cells distribution width means if anisopolykilocytosis is there, the more variation in the size of the RBC is there, the more is the distribution width. The normal range is 11.5 to 14.5 percentage. It measures the variation in the RBC size. Increased red cell distribution width indicates mixed type of anemias such as iron deficiency anemia along with B12 deficiency anemia. So interpretation approach is like this. Look at the pattern. You never rely on a single value, but instead look for the patterns across the complete blood count. Like low hemoglobin is there, if low MCV is there, if low iron levels are there. So if the hemoglobin is less, mean corpuscular volume is less, and iron levels are also less, so this will indicate iron deficiency anemia, and this will be microcytic hypochromic anemia. Consider clinical context. Always interpret CBC results within the context of the patient's symptoms and history. You have to do the follow-up test also. Abnormal results often require follow-up like peripheral blood smear, iron studies, or bone marrow biopsy, depending upon the suspected conditions. Thank you.